Hi, we're here at Flowers Medical Group today at our second Facebook Live event. My name is Misty Croft, and I'm the practice director, and this is Dr. Lynn Flowers. Today we're going to be talking a little bit about integrative medicine and what we do here at Flowers Medical Group. Dr. Flowers, tell us a little bit about your career and what made you want to start the Flowers Medical Group practice.
Thanks, Misty. So we're glad everybody could join us today and learn a bit about us and our practice. I started out in conventional medicine, obviously, went to medical school in South Carolina, and always involved in health and wellness and fitness. And actually, one of my great role models in my life, my father was very fit and active, and so that was a good role model for me. Always involved in sports and nutrition. As time went on, I actually joined the Navy. I was active duty in the Navy, and I learned this concept of mission readiness, where everybody had to be healthy and well and ready to go. But as I learned about that, I realized that really all of us should be that way. My dad developed Parkinson's, and so I began to research ways to help with regeneration and restoration and help with that. And then I discovered a whole area of medicine that was related to health and wellness and regeneration. And so I actually ended up doing training with that, did advanced training with the fellowship in functional nutritional medicine and also the certification in age management medicine. Really as a way to explore a way to help my dad, but then as it turns out, we really have learned to use these principles to help a whole lot of people to be healthy and well in a more holistic way.
And so how did the practice begin?
So we started doing this training, and I became the doctor that would get roadside consults about health and nutrition and supplements, and so we decided to open up a small practice off of Northside Drive, and we started out with 0 patients, and now we've grown tremendously since that time. And our focus was to look at a holistic approach, a comprehensive approach, to take the time and to collaborate with the patients, which these are all the principles of what is now known as integrative medicine, where we can look at different tools to help improve health and wellness, whether it's nutrition or therapeutic doses of vitamins or minerals or plant-based products, but it's also the approach that we take to look at the individual and their health, and it's a very personalized way of doing medicine.
Who would you say is the ideal integrative medicine patient?
So that's a very good question, and I think everyone needs this approach and evaluation at some point. Our patients are certainly engaged in their health. They want to know about their health. Not everyone has an illness or disease. A lot of our patients come to us because they want to be healthy and well and vibrant and have vitality. And the ranges of our patients can be from teenagers all the way up to patients in their 80s. And so there's quite a variety of needs and desires for their health and wellness.
And what other integrative medicine services do you offer?
So we use a number of different tools. Of course, we do a scientific approach. We try to get as much data as possible with testing. We use nutritional medicine. We use herbal or botanical medicines. We even have IV nutrition therapy that we use for our patients. We talk about and teach a lot of the mind-body techniques, because that's really part of the way integrative medicine works, is using all of our resources. And so our health and our wellness and our sense of well-being really relates to a lot of different things. It relates to our mind, our body, our spirit, our environmental, our physical. So all of that together is an important way to help coach and help our patients learn about their principles of wellness and how their body works.
And how can someone become a patient?
Typically, we do initial phone consultation where people can call the office, and we'll set up a consultation to talk to you about your specific health needs or your goals or maybe even problems that you're having. And we talk about what the initial plan would be and evaluation. And then we will have you come in for a lab evaluation. So I like to get labs ahead of time. I like to get full history ahead of time as we generate a personalized and comprehensive treatment plan. That is followed up by the comprehensive visit, which was probably your next question.
Yes.
So the comprehensive visit here is 2 to 3 hours at least, sometimes 4, depending on all the elements that we put together. We do physical examination, we do body composition analysis. We also have the advantage of having Mr. Lee Haney here, 8-time Mr. Olympia, to do physical fitness assessments, and he literally writes the fitness prescription portion of that. And then we do physical examination, and there'll be 2 more additional sessions, one with me and one with Misty. The session with me is going through the medical plan, the treatment, the exact findings and treatment and doses. And then the second portion is the application of that. And so in some respects, I think Misty's job is super important, equally to help execute the plan. So we have a great plan, but we need the assistance to actually put that into action. And so that's your job.
Right. And so what I do is I'll sit down with each patient and help them make a daily plan that works for them in their schedule. And that includes nutritional supplementation, but also teaching them how to use hormone therapy when they need bioidentical hormones. We also go through details of what works best for exercise and nutrition. And then I give them lots of resources, whether they be websites or applications for your phone, and all sorts of different things that might be helpful for them to really make them a good partner with us in helping them really succeed in their goals to health. So that's...
I think that's one of the things that makes our practice unique. It's the personalized treatment plan, it's the comprehensive, and the follow-on with that. So as a part of the practice, people join the practice and we follow along with them to help them reach their goals, to assess their progress, maybe challenges, and we alter that as we go along because our body systems do change as we go through that. So that is kind of one of the other approaches we use as a systems approach or biological systems approach. So we look at each area and how it interrelates with the body. So no individual issue or problem stands alone. It's always in connection with the rest of our body, whether it be our hormonal system, our gastrointestinal system, our immune system, all of that.
So what other additional services, can you talk a little bit about the other services that we have designed through the practice that patients can come and get, either individually or as a part of
Yes, so obviously our education program, so we do seminars in the office, sort of like we're doing here, but we go into more details about that. We have Lee Haney that will do initial fitness assessments, but he will also do ongoing personal training with our patients. We also have individual or small group yoga available, and so Laura Curry is our yoga instructor, very good at meeting you at the level of where you are and helping you to progress. We think yoga is a very good tool. We also will do meditation classes at different times. We have other experts that come in, and many times we'll do joint sessions with me or individually we provide that service for our patients as we continue to educate and help people grow in their health and wellness here.
And really meeting our patients and trying to get them healthy from the inside out. And in doing that, when we expanded the practice to really become more integrative, we also started to offer a few more aesthetic services. And why did you to start?
Yeah, that's interesting. It wasn't necessarily in my initial vision, but more because of what patients wanted. They were feeling better. We also have an esthetician here that does skincare and facials, and sort of the next level with that was actually doing some minimally invasive aesthetics procedure. So once people are feeling good on the inside, then we're also addressing the outside. So I think that those two go together, very important. One of the additional things that we offer is actually cool sculpting. And so again, not necessarily in my initial vision for health and wellness, but as people are feeling better and maybe losing weight and they're looking at their body image, they want to improve that. And so a non-invasive way of doing that is with cool sculpting. And so cool sculpting does focal fat reduction. It's done right here in the office. There's no downtime. So which really fits in with our philosophy of how we're helping our patients look and feel better.
And what else do you want patients to know about Flowers Medical Group? What makes us different than other practices like
So it's really our personalized approach. Everyone is super important when they come here. They're our main focus, not just with us, but we have an awesome staff. That's our whole goal and mission when you come. So each person is important as an individual. There's no cookie cutter sort of program. Everyone is individual. It's designed specifically for you, and it can be as simple or as complex as you need, and it can involve as many systems as we need to approach. And so that's our goal for you, and that's why we're different from certainly conventional medicine and from many other practices.
And in speaking of really individualizing it, talk a little bit about the nutrition programs where we can customize or personalize nutrients.
Yes, that's some really neat things have come about with the technology to be able to look at a broader array of functional nutrient levels in the body. And then also we have the ability to specifically write a formula that's personalized and individualized for each person. And it can be based on our treatment protocols for nutritional or herbal medicines that are needed to treat certain conditions, as well as for deficiencies. And our goal is for always to optimize. And so Lee Haney and I have come up with this concept of performance health. And so that's really how we think of things. So average and acceptable ranges really are how we focus. We're really looking at what's optimal, what's performance health. And that's also how we came to this concept of what we call interventional preventive medicine, because we are really going to be proactive about how do we prevent the disease. So we're a health-focused practice, not a disease-focused practice. So we are looking at upstream how we can anticipate the things that are happening in the body and the changes to prevent disease in the first place. If there happens to be a disease process there, then we're going to look at the least invasive way and the most natural way to treat it. And that's not to ignore the good things that are the elements of conventional medicine, because those are important to address. And so I feel like I have a great perspective from both sides of the equation with conventional and integrative medicine, and do what's best for the patient and not be limited by one side or the other.
And talk about how you and I stay up to date with the most current research and information there is for integrative medicine practitioners.
Yeah, so we are constantly training and researching the latest in the science and the research. Currently, we're both in the integrative medicine program at George Washington University. So we'll have that done this year. So lots of research, a lot of research papers, and that just made sense with where we are when we're looking to be on the cutting edge for the latest techniques, the latest research, and that this is science-based medicine. And so good medicine is science-based medicine. And so I believe that I came from academic medicine and conventional medicine, and I have those same expectations for our practice and how we treat and the things that we use. It may not be a conventional drug or medicine, but we're still looking for the efficacy, the safety, and the science, just like we would in any form of medicine.
That's great. Well, if you would like some more information about the practice, then you can visit our website. It's flowersmedical.com. Feel free to call in for a free phone consultation if you want some more information about being a patient and what that would involve. Dr. Flowers or I are both great as far as getting you in and trying to talk to you as quickly as we can to get you in as a patient. So we're happy to help in any way possible.
Thanks for joining us today.